Dr. Jeff Schels with Advanced Chiropractic, and today we're going to go over how to use the middle back Denneroll traction device. And so if you're watching this video, it was recommended that you use this little traction device to help flatten the curvature in the mid-back. So I'm going to go over how to use it, and then we're going to actually show a demonstration of exactly how to use it so you know exactly what you're doing and you get the very best results. So the goal of this mid-back traction device is to flatten the curve in the mid-back. So if it was recommended to you, that's because you have too much curve in this middle part of your spine. So the spine should be straight from the front or back and curved from the side. But you have too much curve in the side, so the goal is to actually flatten that curve over time. So the way that the Denneroll works is the patient lays down on the Denneroll, and the way that this one works is it actually goes right between the shoulder blades. So I'm going to demonstrate that in a few minutes, but you slowly, very slowly, because this one can be somewhat uncomfortable, you slowly lay back until the top part here is right between the shoulder blades, and then you just lay back over the Denneroll. Now some patients, if they lay back like that, they could get some neck pain, so it is okay to use a small pillow as long as the pillow doesn't hold your head up, limiting the traction in the mid-back. So you want to lay back over the Denneroll so that the ligament that runs in the front of the spine has tension on it and stretches, allowing your spine to flatten over time. So the way that it works is when you first lay down over this, it flattens the curve and it puts tension on that ligament in the front. In the beginning, it has tension, but it doesn't actually lengthen. To make your spine not only flatter, but stay that way, the ligament has to get longer and lengthen. So the first 10 minutes, it puts tension, but it doesn't lengthen. After 10 minutes, it starts to lengthen, and it lengthens for a total of 10 minutes. So that's why when you first lay on it, you only do 3 minutes the first day, and then 4 minutes the next day, and you add a minute a day until you get to 20 minutes, knowing that it doesn't really start till after 10, but that gives your body time to kind of get used to it, because sometimes it's not the most comfortable. So at 20 minutes, you do it 5 days a week. Now you can do it more than 5 days a week, but there's no benefit to doing it longer than 20 minutes at any one time. So now we're actually going to demonstrate how to use the Denneroll. I'll have Nancy come and sit right here, and then she'll swing her legs around. Now, with the Denneroll, when you lay back, you want it right here, right between the shoulder blades, with this part pointing down. So we'll lay back real slowly here and just go very, very slowly so that you just drop back like that. And that's how you do it. You just really relax and let the Denneroll push into that middle part of the spine to open up and flatten the curve. Now, if there's any discomfort in the neck, if the head is too far back, you can use a little pillow. You just want to make sure the pillow is not so big that it's holding the head up and limiting the amount of traction in the mid-back. If you have low back pain, then you can bend your knees up just a little bit, and that will take some of the pressure off of the low back. So again, you just start with 3 minutes and add a minute a day till you get to 20 minutes. 5 days a week is the key. The other thing is you don't want to do it on a bed or on a hardwood floor. The bed, it just presses in. Hardwood floor is just too uncomfortable, so you want to do it on like a yoga mat or a carpet. And then the last thing is, whenever you go to get up, you always want to roll off of it very slowly. You don't want to just sit up because it's too uncomfortable. So we're just going to roll off real slowly and then bring the legs up. There we go, just like that. Now, as you're doing it, you would expect some discomfort as you're changing the shape of your spine. However, if it's ever too painful or it's very sharp pain, discontinue, but make sure your doctor knows about that so we can overcome those challenges. We wish you the best of luck. If you have any questions, just ask your doctor, and we'll see you on your next appointment.